Good afternoon. The topic of my presentation is technological advances in healthcare. Are you experiencing lesser wait times during doctor's or hospital visits? Has technology improved the way that you receive healthcare these days? The purpose of my presentation is to analyze the need and effectiveness of recent technological advances in healthcare, which include the patient electronic health record, telehealth, and the kiosk. As a nursing student, I will be very happy to share with you these technological advances in healthcare that is subtle but yet very effective. The first is EHR. EHR, electronic health record, is known to decrease communication barrier between physicians and the pharmacy. And it does so by way of e-prescribing, where the pharmacist can send medication orders electronically to the pharmacy. And in a matter of minutes, your prescription is ready to be picked up. So telehealth reduces time spent in the doctor's office, and at the same time, it promotes communication between all these healthcare providers put together. EHR is effective in disease monitoring and management. It also helps to coordinate your immunization record, your labs, and your imaging. And it makes the same available to all healthcare providers that are involved in your care. Also, there is ease of transfer of care from one physician to another. It helps to decrease healthcare costs. Also, it helps in detection of fraudulent billing practices. And the best of it all is that it helps to monitor your provider and making sure that you receive effective healthcare from them. So I have a picture of a typical EHR. If you look closely, you will see the tabs here highlighting all the areas of care, and also there's a fascinating feature which says speech to text, which means doctors can actually be talking while they're taking care of you, and the EHR is recording it for documentation purposes. So you can see that the EHR is very important in your care. The next one is telehealth. Telehealth uses emails, it uses audiovisuals, it uses webbing to assess patients remotely without having a contact with them. So with telehealth is very necessary these days because we're beginning to have a lot of sick patients who are chronically and terminally ill in the society. So these patients can stay in their communities with friends and families where they get the help that they need. So telehealth decreases the time spent for communication, for transportation. It also helps patients to get adequate care while not leaving their homes. And also it decreases the need for emergency services. The last but not the least is the self-service kiosk. Self-service kiosk is a form of portal technology. It could also be in the form of handheld devices which patients can have during doctor's visits to check themselves in, to assess paperwork, to sign them as well. So with telehealth, patients are becoming more comfortable to answer assessment questionnaires and also to be able to access their records while right there on doctor's visits. So the kiosk promotes privacy and safety, and it allows ease of data documentation and retrieval. Patients are able to answer questions more truthfully, and they are able to also own up to diseases that they will be unable to share during a face-to-face interview. So with this, people have owned up to having HIV and they've been able to get help. So I have here a typical EHR that is stationed around all hospitals. People can access it and check themselves in during a hospital visit. So in conclusion, I have been able to tell you about the EHR, the telehealth, and self-service kiosk, and how these three together have been able to ease the way that healthcare is being delivered to all of us. So more and more people are getting access to their health records. People are spending less time doing this. People also spend less time traveling, and more so, people have less need for emergency services. So I hope this can help you answer the two questions that was raised at the beginning of this presentation. So I have my questionnaires going around and I have my handouts. Please feel free to leave comments. Thank you so much.